Welcome. Today, we will explore quaternary ammonium compounds and their vital role in infection prevention. In healthcare environments, every surface matters. From door handles and bed rails to equipment panels and nurse station counters, thousands of high-touch points are used every single day. Every touch can leave behind invisible contaminants that fuel infection risks. Microorganisms spread fast across these surfaces, creating silent routes of transmission. With each touch, microorganisms can be transferred, silently and invisibly. They move from surface to hand, from hand to patient, creating hidden pathways of contamination. Within seconds, surfaces can become reservoirs of infection. Within minutes, risks can multiply. Maintaining a safe healthcare environment demands effective science-based disinfection. It starts with choosing the right disinfectant, one that doesn't just clean, but breaks the chain of infection and protects both patients and staff. This is where quaternary ammonium compounds play a critical role. Now let's explore quaternary ammonium compounds, or QACs. They are cationic surfactants widely used in healthcare facilities to disinfect environmental surfaces and surfaces of non-critical medical equipment, helping to maintain a safer, healthier environment. It's important to note that QACs provide low-level disinfection. They reduce microbial load but do not achieve sterilization. Making proper use and application are crucial for infection control. Several common examples of QACs are routinely used in healthcare and laboratory settings. Benzalkonium chloride is widely used in disinfectants, hand sanitizers, and even in certain eye drops. Acetyl-trimethylammonium bromide is commonly used as a laboratory reagent and in some antiseptic formulations. Dimethylammonium chloride is frequently used as a surface disinfectant. Alkyl dimethylbenzylammonium chloride is another commonly used compound found in cleaning agents and surface sanitizers. Each of these compounds works on the same fundamental principle of membrane disruption. At the core of every quaternary ammonium compound, there is a positively charged nitrogen atom, with a permanent positive charge that allows strong attraction to negatively charged microbial cell membranes. Surrounding the nitrogen are 4 substituent groups, which vary depending on the subclass and often include at least one long hydrophobic carbon chain. A counter ion, often a halide or sulfate, is also present, which balances the charge. This unique dual amphiphilic nature allows quartz to interact effectively with microbial cell membranes. The strong attraction between the QACs and negatively charged surfaces of microorganisms makes them the highly effective membrane-active antimicrobial agents. By understanding how quartz work and applying them correctly, healthcare facilities can break the chain of infection and maintain safer, cleaner environments for everyone. So how do quartz work? The mechanism of action begins with membrane binding. Positively charged molecules, such as DDAC, attach to negatively charged bacterial cell membranes through electrostatic attraction. Next comes membrane destruction. The hydrophobic carbon chains penetrate and disrupt the lipid bilayer structure of the cell membrane, compromising its integrity. As the membrane becomes destabilized, cell leakage occurs. Essential intracellular components begin to escape, impairing vital cellular functions. At the same time, quartz cause protein denaturation. Critical enzymes and structural proteins lose their functional shape, further damaging the microorganism. The combined effect of membrane disruption, leakage of cellular contents, and protein denaturation leads to irreversible damage and ultimately cell death. Quaternary ammonium compounds are grouped into 5 generations according to their chemical structure, antimicrobial range, and tolerance to organic matter. Although this system is primarily commercial rather than universally scientific, it reflects the progressive improvements in effectiveness and formulation across generations, each with unique antimicrobial characteristics. For example, DDAC is categorized under 4th generation QACs. It is the main active component in Fumiquad, which contains DDAC at 7% weight by weight. 4th generation QACs are known for improved efficacy better tolerance to organic load, and enhanced performance compared to earlier generations. First generation QACs like Benzalkonium Chloride, alkyl dimethyl benzyl ammonium chloride, is effective against gram-positive bacteria, fungi, and enveloped viruses, whereas it has limited activity or is ineffective against gram-negative bacteria, mycobacteria, bacterial spores, and non-enveloped viruses. Its activity can also be reduced by organic matter and hard water. Because of these properties, first-generation QACs are commonly used on low-risk hospital surfaces and in household disinfectants. Overall, it is a safe and effective disinfectant for specific applications, with limitations to keep in mind. Second-generation QACs target most bacteria, fungi, and enveloped viruses, but are limited against spores, Mycobacterium tuberculosis, and non-enveloped viruses, and they are commonly used for general healthcare cleaning, especially in clinics and outpatient areas, as they offer moderate activity and better resistance to organic matter than their precursors. Third-generation QACs are active against gram-positive and gram-negative bacteria, fungi, and enveloped viruses, but remain ineffective against spores, Mycobacterium tuberculosis, and non-enveloped viruses. They offer broader spectrum, better hard water tolerance, and improved cleaning, making them suitable for hospital floors, wards, and diagnostic areas, though they are less effective with organic matter and not for high-level disinfection. Fourth-generation QACs are effective against gram-positive and gram-negative bacteria, fungi, enveloped viruses, and partially effective against mycobacteria, but not against spores or non-enveloped viruses. They offer strong gram-negative coverage, longer residual effect, better surface adhesion, and lower equipment corrosion, making them ideal for OT surfaces, ICU areas, patient beds, trolleys, and equipment exteriors, though they remain unsuitable for high-level disinfection. Fifth-generation QACs are active against gram-positive and gram-negative bacteria, fungi, enveloped viruses, and improved mycobacteria, but remain ineffective against spores and non-enveloped viruses. They offer broader spectrum, faster kill, better virucidal activity, and improved tolerance to organic matter, making them suitable for high-risk hospital areas, diagnostic labs, emergency rooms, and medical equipment surfaces, though pre-cleaning is still required and they are not for high-level disinfection. Comparing the generations of quartz reveals differences in antimicrobial spectrum and resistance to organic matter. The fifth generation stands out for its very broad spectrum and high resistance, making it suitable for critical hospital areas. But remember, quartz are not suitable for critical instruments. They are not sporicidal, do not sterilize, are ineffective against Mycobacterium tuberculosis, and are not approved for invasive medical devices. Also note that quartz are also not recommended for semi-critical devices that require high-level disinfection, HLD. They may only be used for external surfaces of semi-critical devices, non-patient contact parts, because semi-critical devices require HLD, while quartz are low to intermediate level disinfectants, and also their action is limited against mycobacteria, non-enveloped viruses, and also biofilm formation occurs on complex devices. While taking non-critical devices reprocessing, a common question arises. Can quaternary ammonium compounds be used for non-critical device reprocessing? The answer is yes. Quartz are recommended for non-critical devices because they are safe on plastics and metals, provide good residual activity, and are effective against common bacteria and fungi. However, it is essential to remember that QACs are intended only for non-critical devices and environmental surfaces. They are not appropriate for semi-critical or critical instruments that require high-level disinfection or sterilization. When used correctly, QACs help maintain a clean, safe, and hygienic healthcare environment. Using quartz involves preparation, pre-cleaning of surfaces or equipments, dilution of QACs, disinfection, and post-disinfection steps. Proper use ensures effective disinfection and safety in healthcare environments. Before using quartz, safety is key. Work in a well-ventilated area. Gloves are mandatory. Mask is recommended in patient areas. Eye protection if splashing is possible. While preparing QAC solution, always prepare a fresh solution if using a concentrate, and label the container with the disinfectant name, dilution, and preparation date, time. Before applying quartz, pre-cleaning must always come first. Removing visible dirt, blood, or organic matter is essential because leftover debris can reduce disinfectant effectiveness. Use plain water with detergent or a neutral cleaner recommended by your facility. Do not skip this step. Effective disinfection depends on proper pre-cleaning. Once surfaces are pre-cleaned, it's time to apply the QAC solution. There are several ways to do this safely and effectively. Wiping with a cloth is the preferred method. Mopping is also acceptable for floors, and spray and wipe can be used, but avoid aerosolization to reduce inhalation risk. Ensure that the surface stays visibly wet for the full contact time. Follow the manufacturer's recommended contact time. Do not wipe the surface dry before the contact time is completed. Always use clean cloths or mops for each surface, and also immediately discard or segregate used cleaning materials to prevent cross-contamination. After the QAC solution has been applied for the recommended contact time, allow the surface to air dry completely. Do not rinse the surface unless it will come into contact with food or the manufacturer specifically advises rinsing. Once disinfection is complete, remove personal protective equipment and perform proper hand hygiene to maintain safety and prevent cross-contamination. Effective infection control depends not just on proper cleaning and disinfection techniques, but also on the frequency of disinfection. High-touch surfaces should be disinfected in every 2 to 4 hours. Following the correct disinfection frequency ensures that microbes are consistently reduced, helping maintain a safe and hygienic healthcare environment for both patients and staff. Patient beds and furniture must be cleaned daily and after each patient discharge. Floors and walls should be disinfected daily or as needed. Any area with a spillage must be disinfected immediately. To ensure the safe and effective use of quaternary ammonium compounds, always clean surfaces before disinfecting to remove organic matter. Use the correct dilution of QAs and prepare a fresh solution daily. Use separate cloths for clean and dirty areas. And follow the recommended contact time to ensure maximum disinfectant effectiveness. At the same time, avoid mixing QACs with soap, chlorine, or other detergents. Do not use them on invasive devices. Never spray directly on electrical panels. And do not reuse contaminated cloths. Following these guidelines helps maintain disinfectant efficacy, protects staff safety, and ensures a hygienic healthcare environment for patients and healthcare workers. Quaternary ammonium compounds are versatile disinfectants used across industries. In healthcare, they disinfect surfaces and medical device exteriors. In water systems, they control microbial growth in cooling towers and pipelines. They are common in household, institutional, food industry, veterinary, and agricultural sanitation. QACs also have specialized uses in pharmaceuticals, textiles, and laboratories, making them vital for hygiene and infection control. QACs are powerful disinfectants but must be handled safely. Wear gloves and goggles to avoid contact, never ingest, and store away from heat and sunlight. Dispose unused solution as per hospital policy. Avoid mixing with soaps or detergents, and always follow the manufacturer's dilution instructions. Despite the effectiveness, QACs have some important limitations that must be understood. QACs are effective disinfectants but not sporicidal and have limited action on non-enveloped viruses. They are less effective on dirty surfaces, unsuitable for invasive device sterilization, may leave residue, can cause microbial resistance if misused, and may irritate skin. So always handle with care. By understanding how quartz function and applying them correctly, healthcare facilities can significantly reduce surface contamination and interrupt the chain of infection. Proper usage transforms routine cleaning into a powerful infection control strategy. Infection control is not just about cleaning. It is about applying science with precision. Quaternary ammonium compounds play a vital role in protecting healthcare environments, ensuring safer surfaces for patients, healthcare workers, and everyone who enters the facility. Thank you.